Hi, my name's Saul Helgeson. I'm a physical therapist at OSI Physical Therapy, and I wanted to just touch base with a lot of the patients that come in for this routinely, just to see what kind of physical therapy can do. And it's a condition that we see all the time that we want our patients to kind of know, so then they can come in and make sure that they come into the right people first, which we would be the best to kind of assess this and then treat it as well. What I wanted to talk about today was kind of the cervical thoracic junction, or the CT junction. It's the area where the bottom of your neck kind of meets the top part of your thoracic spine. From what we see, and what I look at quite a bit for patients that come in with this, is a lot of their complaints, which are a lot of tightness on the upper part of their shoulders and neck, sometimes numbness and tingling down into their arm, preferably usually in the inner aspect of their forearm or hand. They can also get headaches that sometimes will feel like it's just tight here, that sometimes radiate up into the top or the front of their head. Also maybe some stiffness or tightness around the shoulder as well. So just to give you an idea of what we look at and what I'd be looking at, after we do a pretty big subjective discussion with their symptoms, and we kind of ruled in that I want to check this area, the first thing I'll do is just check out general posture. And my model here has really no big issues. We've kind of already done some screening stuff out already, but for her what we can kind of see would be the alignment or the posture of this area all the way even down to her mid-back. From there though, if she had some, say, limitation of her neck, say like going to the right, it kind of hurt. So what I would look then would be using my hands, and that's what we'll do quite a bit to kind of diagnose things, would be finding that joint line, that area, and then I'd be using kind of my fingertips to kind of come in and basically feel for those joints moving. So I'll have her rotate to the right, and what I'm looking for is this right side of my hand, my index finger, to kind of come downward and inward, and the opposite side to do the reverse. And if I feel something stiff there, so I could have her rotate again, and then I'd actually do a little bit of an overpressure there to see if that caused pain, soreness, or I just feel like it's pretty stiff in that joint. Another thing I can do is with people that have a lot of forward head posture is to just teach them how to do a proper retraction. And so that's what I'm also doing, is feeling for both sides of that to move downward symmetrically. So I'll have her do that again, and both sides should come down in a nice smooth pattern. If one side's kind of lagging behind or staying higher, again, that'd be another indication for me that it's stuck there and we need to drive it backwards to restore that motion. So a couple things I will do if I figure this out would be a couple different things. The first thing I would look at, or we could do, would to get her on her back, so we could put her head down this way. And again, it's the right side, so I want to get that right side to drop down to allow her to move her head backwards and also to the right. So I can come over on her left side, and what I would do is have her move a little closer to me, and use her hands to kind of help. So especially since it's an upper area, I could have her put her hands kind of behind her head, just interlace her fingers. And from there, just make sure that her shoulders are good, so I'd kind of push down through her shoulder girdles just to make sure there's no pain in her shoulder, I'm not hurting her neck. And then I'd say, is that okay? She'd give me yes, that's fine. So I'd kind of roll her over to me, so I'd bend her left knee, and kind of, again, palpate back here for the joint I want to kind of isolate and identify. So I'd come a little bit offset